So what did you have done today?
Well, I had, I went for another round of Botox because prior to that I was a little apprehensive and just had a little and wanted a little more. And the main thing I had done was filler in my laugh lines, and I have had some skin cancer years ago that was removed by a plastic surgeon, but what happened as I have been aging is the surgery was around my nose and my laugh line, so the creases here were uneven. So now with the filler, I'm more symmetrical. So, like, what a great after effect that I never realized. I just knew that I was always a little lopsided, and it was more pronounced as I got older.
So, and with the Botox, what made you decide to get more this time?
I guess I still had a crease here that I've had that started in my 20s. I think I sleep with a frown. And so I was just a little braver and said, I trust Dr. Cockerham completely, and just said, okay, go for it. Where previously I was a little nervous and like I said, apprehensive, scared, but now I have much more confidence in myself and of course in the doctor.
How about you, Sarah?
So for me today, coming here, I came for my final photos, and I was thinking I was just going to do photos and then go home. But I ended up getting filler. When I looked in the mirror, I thought, I can definitely use it around my mouth, and I just felt very confident here, and that's a big part for me. I was a little nervous coming here, much like I was the first time, but once I got in here again, I just felt really comfy and at home, and I felt like, I don't know, I felt like the doctor is my friend, and so we just kind of hung out, and it's like, yeah, well, we can make this look better, and so there was a comfort level. So I ended up getting filler, and the first time for me for Botox, I was so scared of everything.
She almost walked out and didn't get Botox the first time.
I was out.
What scared you about Botox?
I thought I was going to get botulism. I know it sounds crazy, but I really did, and I was afraid that, you know, why would I set myself up to put something in my body or in my skin for vanity reasons? Silly. But, you know, I did the Botox the first time, and I have to say, it was such a small amount, and maybe there was a softness, but maybe it was in my head, maybe it was something I wanted to see. So today when I came back, I actually brought it up, and I said, actually, I want more Botox, and I went from doing 10 units the first time to 30 more today. And I'm so excited, and I wasn't nervous. In fact, for the Botox this time, I had no numbing. I did have numbing for the filler, and I'm really glad I had numbing. It's not terrible, but there's a lot of shots, and
it's uncomfortable. I mean, you can feel it. I had numbing too. I had a lot of numbing, and I'm glad I did. And
numbing's pretty much wearing off now.
Yeah.
But it was it just stung. I think it wasn't so much the shots, but I felt it a little bit afterwards. But as soon as we put the, what is it, antibiotic or bacitracin or whatever it is that we put on afterwards, and Dr. Kim rubbed everything out, my pain was gone.
I mean,
it wasn't even
not
pain.
painful.
It was like a little bit of a sting, but I see the results immediately.
So with the Botox, how soon did you see results? Because we're now about 3 weeks after your original small amounts of Botox. When did you start to see a difference?
It took longer than I thought. I thought it would take 3 days or sooner. And I pretty much went on the web and read everything about how long it can take, and, you know, I did. And I think probably 4 or 5 days when I thought I saw some softening, maybe 5 days. But again, we didn't put very much in because I was such a scaredy cat. So
we just did a bit. But I gotta say, we previously did an IPL treatment, and that's why we're doing the before and after photos. So the after photos we have of the IPL. And I saw Sarah 2 weeks after, or maybe just a week after she had her IPL done, and her skin looks fabulous, and I was like, wow, I was amazed. And it seems that with the IPL, your skin keeps getting better with time. And I've had so many people compliment me about my skin. I used to wear more of a base makeup, and I don't wear the makeup now. I feel like my skin is very even toned. I wear my sunblock. I have some tinted sunblock sometimes I wear if I want a little color, but it's amazing. I think for the IPL, the one thing I wanted to change about me was my pores, because I feel like I don't know if it's my mind, but as I'm getting older, my pores are getting larger, and I know it's definitely in my genes, and my siblings have bigger pores, and that was like the surprising, wonderful after effect of the IPL, along with even getting rid of some fine lines. I mean, the evenness is great, but I've had friends that saw me after she'd been out of town for a month and just said, oh my gosh, what did you do to your skin?
I have people stopping me mid-conversation and just saying, oh my gosh. And same with as far as the makeup goes for the IPL, and I usually use my Bare Essentials, my powder, but I just haven't even been using makeup so much. And but I think what I am now is a little bit more obsessed with the sun, because I think any bit of sun, like I don't want any more of those brown spots. Like I feel like I'm finally just this one great even tone, and I can, I just feel like it's where my face is supposed to be. So.
And you guys look really good. You've just had Botox, you've had fillers, you don't look too bruised. What did you do to not bruise?
I did not take any Advil, aspirin, or anything like that before I came. And I think that's another thing. I'd never heard that before. So when I came here, I was really happy that I was told that beforehand, not to take any Advil or aspirin.
There's pre-treatment care and instructions, which I've never heard of before, going to other places and what to do and what not to do. What's different is you're treated like a patient as opposed to someone just getting their nails done or a facial or a different environment. And the biggest thing is the doctor does all the procedures. And I've been to other spas, and it's not the doctor. You don't see the doctor ever. It's I don't know their degrees or what they're doing, but it's absolutely a different level of training, because it's not a doctor doing this, and I have full confidence in Dr. Cockerham doing all the work.
Well, just what Julie and I were talking about as well, is about we were able to come in together. I sat in and I watched Julie's whole procedure, Julie sat in and watched my whole procedure, and we talked, and the doctor was in with us, and we were all just very comfortable. And even though her schedule is busy and she's got clients and patients, I felt like I was the only one in the place. I felt like her attention was just on me, and she was taking care of my face.
It's easier to do it with a friend. We like you weren't going to.
Could I have come today if I came by myself?
No,
to do
you wouldn't
my
have done
photo shoot?
anything. You wouldn't have done anything else. You wouldn't
Just
have done
because
filler.
I'm a scaredy cat, but I feel great.
Yeah.
I'm happy about my results, and it's no pain in it. You look fabulous.
Yeah.
Another wonderful thing about the IPL is there was no downtime. I mean, it was the next day, the day after, that I felt a huge difference in my skin. And by the time it was a week later, it was wonderful.
Yeah.
So I felt that too, that someone doesn't have to think, oh, I can't go in and get this done because I'm going to look terrible for 2 weeks or a week. It was a pretty amazing procedure. The results, to me, it seems like there should have been more downtime with these sort of results.
The other thing that we did with the IPL is on our chests, which makes a huge difference. And I think as you age, if you're in the sun a lot.
But our hands.
And our hands, wow. So many women that are my friends that are starting to get some age spots and pigmentation on their hands are so interested in IPL for their hands. I mean, if anything, that just makes you seem like, an old lady, and you could be getting age spots in your 30s. So check that out, because that's so non-invasive. It's a great little procedure, and it makes you feel fresh.
Anything else on your self-improvement to-do list?
The FX. FX.
Yes, Active FX.
The Active FX. I've looked at that for a long time. Thought about for a long time. Didn't know if I could do it. Didn't know if I was comfortable. Again, I was scared to do a lot of these things, but I think that's probably in my cards. I'd probably talk to a doctor, but I'd either do more of a series of the IPLs, or I would go straight to the FX. And I think whatever I'd get more benefit from. And I think the active FX is more of there's more downtime, a little more downtime, but I still think it's worth it.
I think now what I want to do is some, and this is to be done after the summer months. I'll do some laser hair removal on my forearms, which I'm doing wax right now. And I want to have the spider veins on my legs done, and there's a little downtime with that where you have your legs wrapped. You can't work out for about a week, so I'm not prepared to do that during the summer months, but I will come winter.
Sounds good. Thanks, guys.